想跟主播、小编们在微信上直接互动，欢迎扫描二维码添加官方微信，加入浩视频粉丝群。整个洛杉矶地区数据激增，洛杉矶市长加西提7月8号周三表示，如果新冠确诊病例和住院人数继续上升，洛杉矶市可能会恢复居家禁令。据报道，若洛杉矶市再次重启居家禁令，洛杉矶居民将会被命令留在家中，同时停止该地区大部分经济活动。加西提市长表示，洛杉矶县超过50%的检测呈阳性的人年龄在18至40岁之间。请记住，就在几周前，这个数据还只是30%。
Today's COVID infection threat level remains at orange. That's bad. That means that the risk is high, and you should assume that everyone around you is infectious. Continue to stay home as often as you can and only participate in essential activities. If things get worse, that dial could move to red in this coming week or two. That would place us at the highest risk of infection, and we'd likely return to a mandated safer at-home order. But if things get better, we'll see that dial back down to yellow, indicating we're successfully flattening the curve again. And I'm grateful to everyone who's taking this threat seriously. What you do matters. The actions you take have consequences, and we are making progress. And while it is fragile, it is still progress. We came together and slowed the spread of the virus in March and April and May, and we're doing that again right now. But to be clear, on the other hand, and we've all seen it, we know it, maybe some of us have participated in it, there are still too many social gatherings. Maybe too many pool parties this weekend, too many play dates, too many family barbecues, not just with your household, too many group activities. This is what COVID-19 thrives off of, the momentary pleasures of one day that stay with all of us for months in the days ahead. Today, more than 50% of the people who are testing positive in Los Angeles County are between 18 and 40 years of age. Remember just a few weeks back it was 30%? Then when I talked to you last week it was 40%. Today 50% of those cases are with our younger Angelenos. So to young Angelenos and Angelenos under 40, please do your part for all of us. To parents, I need your help. I need you to keep your children away from parties and gatherings with their friends. I know it's the summertime and our muscle memory goes back to being together, to want to hang out with one another, to thinking, well, I don't know anybody who's been sick or in the hospital, so I'm probably okay and they're probably okay. Maybe I'll get together in a group instead of hopping on a video chat, or young people that we see not covering their faces and physically distancing. And most young people are doing the right thing, I want to be clear, but it's clear that a lot of them are not still. And so they're winding up in the hospital, or if they're not winding up in the hospital, they're passing on to their parents and their grandparents this deadly disease. This isn't complicated. Do not get together with someone who's not in your household. These weeks are absolutely critical. Critical to whether schools open, whether our economy and our economic recovery path continues. These weeks are critical for saving lives.
与此同时，洛杉矶县卫生官员报告了新冠住院人数的惊人增长，引发了对死亡人数可能激增的担忧。7月8号周三，洛杉矶县新增2496例新冠感染病例，另有65人死亡。洛杉矶县新冠病例总数达到了123004例，其中3642人死亡。上周，加西提市长宣布，洛杉矶市将开始通过一种颜色编码指标分享新冠感染威胁级别的信息。该指标将传播风险分为4类：红色、橙色、黄色和绿色。市长表示，未来几天由于需求激增，新冠检测预约仍然爆满。该市在周六和下周将增加更多检测。根据他的说法，到周四上午，市和县的测试点将对超过100万人进行新冠检测。市长告诫民众，检测阴性并不是参加聚会的通行证。他强调，人们不应该出去和家人以外的人进行社交。
The next 2 days are booked up as we make up for the holiday weekend, but we are adding more tests on this Saturday and into next week. And we're seeing our turnaround times skyrocket across the country to 7 or 8 days, but here it's still 1 to 2 days. These numbers are among the strongest in the nation, but let me be clear, it is not enough. We need more help with testing. As I've shared with you in each of these gatherings, the city of Los Angeles doesn't even have a health department. We knew nothing about testing when we started this. But we decided to step up without prejudice about where you live to anybody in the county and offer at no charge testing conveniently where people are at. We expanded that from people with symptoms and frontline workers to those who had been exposed or believed they were exposed, and then to asymptomatic folks who need to go back to work or other things like that. We hear every single day that there are not enough tests. And while we had just 2 weeks ago more test capacity than people were using, we know this last week pinched that capacity, and we are building that up, expanding by almost 100% the number of tests in the city sites across the city of Los Angeles. We see choke points nationally in the supply chain, everything from reagents to some of the swabs, and the surge in states like Texas, Georgia, and Florida have caused labs to be past their capacity across the country. Though I want to be clear, the ones that we have here and the curative tests that we have are able to respond quickly, we're able to ramp them up, and we're going to continue doing that. But without a major boost in testing, which we will be fighting for in the next coronavirus relief bill, these numbers nationally are not sustainable. There's no way we can functionally reopen the economy or safely reopen our schools. And to be clear, schools will only open when they are safe. And this is a key part of it. Congress and the President need to set aside any of their differences and to pass another relief bill now. Expanded testing and direct assistance for cities like ours that are stepping up and paying out of our pocket for these tests. Funding more local community health workers, real small business assistance, expanded benefits including unemployment, another cash payment for folks who are struggling, and aid for state and local government. It is a clear, crystal clear list that isn't about red or blue, Democrat or Republican. It is about red, white, and blue, and these United States of America. If we are to be one nation, we need to step up and continue to prove it. So testing remains a critical tool. You may not realize it, but you can ask your own doctor for a test if you have any symptoms at all. You can also get tested at CVS and at community health centers. There's in fact more than 100 places that you can get a test, and they're all listed at coronavirus.lacity.org/testing, or just call us at 311 if you don't have internet access. It's a no-brainer. If you think you've been exposed to COVID-19, go get tested. But we've had a lot of questions about whether everyone should get tested and get tested regularly. Today, the County Department of Public Health gave some good guidance on this, on who should get tested. They said that tests should be prioritized for people who have symptoms, those who think they've been exposed, or who are essential workers or work in a high-risk environment. We're receiving reports that people are getting tested so that they can just go out and hang out with folks. That's not what these tests are for. A COVID test isn't an excuse to break the rules and engage in social gatherings outside your household. It's not an excuse to not wear a mask or to not maintain social distancing. A test is not a passport to party. Don't go out with your friends. More people are getting sick. Supply chains are getting constrained. So we're asking you to be responsible, even as we offer these tests to all folks with and without symptoms, about when you get a test and why. It will help save lives.
市长还宣布了紧急租房者援助计划，该计划将于周一启动，提供1亿美元帮助租房者免于驱逐。市长说，他为租房者提供了经济上的缓解和额外的保护，同时也为房东提供支持，这真是一个双赢的局面。
We also know that every single day, this is not just a healthcare crisis, it's an economic crisis. People are suffering, and I want to speak to some help that is on the way. We know that folks can't pay their bills. They're worried about whether they'll lose their homes, whether they'll get kicked out of their apartments, whether they can put food on the table or meet some of their basic needs. Too many people are struggling these days, and that's why early in this crisis, we took swift action, putting a moratorium on evictions. We froze rent for our city's rent-stabilized units. And that's why I worked with my city council colleagues to prohibit landlords, too, from taking advantage of tenants and to guarantee renters a private right of action if emergency protections are violated. And as I've always said, for those who can pay their rent, they should pay their rent, because landlords have expenses and many small landlords are also having financial difficulty now. And the last thing we want to see is our mom and pop landlords in this town lose their apartments, get bought by the banks, or go to the banks and get bought up by corporate housers. We know that many tenants still, though, cannot meet their rent obligations. That's why, working with our City Council and Council President Martinez, we've created the Emergency Renters Relief Fund, which will be the largest renter relief fund in this nation. It provides $100 million to help renters stay in their homes and get welcome relief from the financial stress that they are experiencing. This program provides 2,000 badly needed dollars to help cover rent for our hardest hit households. If you're an 80% of your area median income, the average income or less, and it gives financial relief and additional protection to renters as well as support to landlords. It's really a win-win-win. Eligible tenants must live in the city of LA, be economically impacted by COVID-19, the loss of job or hours specifically from that, and have that household income at below 80%, which for a family of 4 is about $83,500. All renters can apply, regardless of whether they're immigrants or not, wherever they live. It is universal. Now, applications for this program will be accepted starting this coming Monday, and we'll be talking more about this. You'll be hearing from City Council members, City Council President Martinez, myself about this each day. But it opens up on Monday, July 13th at 8 a.m. and remains open until midnight on Friday, July 17th. It is not a first-come, first-served program, so don't worry about needing to call or log in on that first day. That will not impact the order that you apply in this coming week, will not impact whether or not you are selected.
以上就是本期聚焦的全部内容，我们下次再见。